good day, everyone. It's a pleasure to moderate this panel titled Performance Management in Government Reform. I think this is obviously a very important panel as we, in the field, continue to think about strategies to help government run more efficiently, more effectively, more equitably. And given the theme of this symposium, it is very appropriate that we begin to re-examine the effect of the Government Performance and Results Act. So the panelists here are specifically looking at reform and strategic planning from that perspective. We have four very interesting and I'm excited to hear presentations by the group. The first will be by J. Woody Stanley, Matthew Troy, and Hannah Stewart, titled Comparative Analysis of Agency Strategic Plans in 3 Presidential Administrations. This presentation compares the strategic plans of the Obama, Trump, and Biden administrations, and specifically how closely do strategic plans released under current President Biden follow the GEPRA requirements. The next presentation will be by Edgar Hollandsworth, Institutionalizing Performance Management Reform. And here we'll hear the presentation where it examines the factors that lead to institutionalizing of performance measurements in government. What are those factors, perhaps? The next presentation by Kevin Bronner, titled The Use of Strategic Planning by County Governments in New York State, explores the relationship between the total size of New York County governments and whether or not that influences the use of strategic planning. And finally, a presentation in a paper that I've had the pleasure of reading, and I'm very excited to hear the next steps in the research by Kevin Marino, Robert Wright, and Ken Powers, titled GEPRA and Administrative Tethering. This presentation examines the forces, relationships, I would say, and structures that bind administrative organizations together. So without further ado, let's begin this panel. Again, we'll start with J. Woody Stanley.
Okay, thank you, Mark. Can you hear me? Yes, good morning, everyone. My name is Woody Stanley, and with me today is Matthew Troy. Hannah Stewart is unable to join us this morning. Let me share my screen. Let's see. Sorry, just a second. The title of our presentation is Comparative Analysis of Agency Strategic Plans in 3 Presidential Administrations. And in this presentation, we're going to provide an initial look and review of plans written under President Biden and draw some comparisons with plans that were written during President Obama's 2nd term and President Trump's administration. In addition, we take an initial measure of the agency evidence building plans or learning agendas that were released at the same time to meet new OMB requirements. Our review looks at strategic plans and learning agendas that were released just 3 weeks ago during the week of March 28th. In a previous paper that was published last year in Public Performance and Management Review, Stanley and Lutz observed that CFO agencies adhered to a rational planning design during the transition from Obama to President Trump. Strategic plans written under President Trump were somewhat less compliant with OMB guidance and included slightly fewer goals and objectives. And in this study, we continue this by comparing results from President's initial analysis of plans written under the Biden administration with plans written under President Trump's administration. And we're going to build on this design score methodology that was reported earlier in the paper and assess whether newly released learning agendas also adhere to the OMB requirements for Evidence Act implementation. Here's some of the key questions for our research. I won't read the list, but you can see here we're focusing in on the requirements that are in OMB A11 Part 6, and then also the memoranda that came out in the last 2 years with respect to Evidence Act implementation. Our view is that strategic plans are the linchpin of the federal performance framework. And as such, we reviewed 17 CFO agency plans that were released just 3 weeks ago. And of the 17 plans, about 9 of those were able to compare with plans written in the Obama administration and the Trump administration. So in the past 3 weeks, we coded the plan components using this design score method reported earlier. And then we counted and compared the number of goals, objectives, and agency priority goals in all 17 plans. And at the same time, we developed a scorecard using the same approach for the learning agendas, using the Evidence Act guidance from OMB, and reviewed 16 learning agendas. We adopted 15 criteria to determine a design score for each agency plan. Each criterion was determined by 2 independent sources. First, we used John Bryson's definition of what is commonly found in a public sector strategic plan and identified 10 key criteria based on that list. And then next, we crosswalked the specific requirements for a strategic plan from Circular A11 to Bryson's list of components in order to determine the continued validity of each criterion as a part of the tool. We added 5 additional criteria based on OMB's unique requirements for federal agencies. The criteria that we adopted were the same as in prior year studies. Here's some results from our initial analysis of the 9 strategic plans. You'll see here on the left, the components for the design score are posed as questions. And then in the 3 columns to the right, the number of agencies in each administration that actually had that component in their plan. And here you can see the components that are most common in strategic plans, according to Bryson, are found in federal agencies. So for example, number 6, the first in the row there, having goals and objectives. Number 2, expressing a mission statement or core values. Number 5, having key issues and challenges facing the organization spelled out in the plan. And then number 8, providing implementation strategies or action plans. So what we saw is across all 3 administrations, a common set of core components that are included in the strategic plans. And then other components over time, you'll see in each administration a slightly less emphasis on those components. For example, in the Biden administration plans, they're less specific about the outcomes of their agency efforts, and also the contributing programs that are they're under their authority. And what we think is happening here is that they're not necessarily ignoring these, but maybe these components are showing up in annual performance plans and evaluation plans. But one of the things we're trying to do is look at over a length of time, a longitudinal analysis of how the design of the plan shifts. And this is our first cut at the Biden administration plans. We also looked at the number of goals, objectives, and agency priority goals in the 17 plans that were available and compared that with the previous 2 administrations. And we see there's roughly some constancy across these 3 administrations. The number of goals, slightly lower in Biden's administration than in the plans written under Biden, but that's because we still have 6 plans to review. They haven't been released yet, 6 agency plans. And more than likely at the end, you're going to see that the Biden administration totals, the plans written under the Biden administration will be roughly equivalent to the number that were in Obama's administration. And of course, that's much more than what was found in the Trump administration review. Same thing with agency priority goals. We saw that peak under the Trump administration, and now we're looking at a fewer agency priority goals based on the 17 that we've seen so far. One of the things that's interesting is to look at whether the goals change over transition from one administration to the next. And we found in the 81 goals that are currently in the plans that we looked at, 58% are new or different from prior administration, whereas 42% are roughly the same. So agencies are turning over and developing new goals in their plans. And the same thing with the agency priority goals. During the review, we found that roughly 3/4 of the APG's agency priority goals were new statements, and only a few are carrying over from the Trump administration. These documents are actually policy documents, and we see they reflect the policy and management priorities of the administration. And it's never more evident than if you look at the emphasis on climate-related objectives. In the Biden administration, and in the plans written under the Biden administration, you see 13 of the 17 plans have at least one strategic objective related to climate. And here's an example for NASA. And in the area of management or administrative priorities, we see workforce-related objectives in 15 of the 17 agency strategic plans. And when you compare that to the Trump administration, of course, climate was not mentioned in a single strategic objective in any of the agency plans under President Trump, written under President Trump. Whereas under Obama, we saw roughly 12 plans that had a reference to climate. So the policy shifts that you see in the plans that reflect the priorities of each administration. And this is something that could be explored further. We've just started looking at this. Now I'd like to turn it over to Matt, who will discuss the initial review of agency learning agendas.
Thank you, Dr. Stanley. So shortly after agencies published their 2018 to 2022 strategic plans, the Foundations for Evidence-Based Policymaking Act was passed. One of those requirements include a learning agenda in their strategic plan as an appendix. So learning agenda is a 4-year plan with a set of questions that, when answered, will help the department make strategic decisions. So similar to the strategic plan design scorecard, on the next slide, we created a scorecard for agencies' learning agendas. So we use the Evidence Act itself, what's required, guidance from the Office of Management and Budget, and created a design scorecard where we reviewed 16 learning agendas. First, making sure that there are clear, concrete priority questions, looking at administration's priorities, and so forth. So lastly, we'll wrap up with some quick conclusions. Overall, as Dr. Stanley said, strategic plans are consistent across administrations. The most recent plan slightly less adherent to get Brahma requirements. There is a very strong emphasis on agency strategic plans aligning to the Biden administration. And then overall found that learning agendas were adhering closely to OMB requirements and the Evidence Act. So with that, I know we're at time. I'll pass it back to the moderator.
All right, great. Thank you very much. And we'll hold off the questions to the end, obviously, with the questions posed in the chat. So thank you very much this morning. The next presentation is Edgar Hollandsworth, Institutionalizing Performance Management Reform.
Good morning. Can you hear me? Okay, well, happy Earth Day, fellow government reform fans. I'm Ed Hollandsworth. Last December, I successfully defended my dissertation in public administration at Virginia Tech Center for Public Administration and Policy in Arlington, My advisor was Professor Matt Dull, and my very generous practitioner mentor was John Kamensky. I also got a lot of help on my project from 8 members of the National Academy of Public Administration who have many more years of leadership experience in the management of performance management than I do. I wanted to study the challenges of public sector reform, and I have a career-long interest in public agency performance. So I decided to study the factors that affect the institutionalization of GIPRA and the GIPRA Modernization Act, or GIPRAMA. Now give me just a moment and I will try to push my slides to you. Yeah, so I wanted to mostly discover why the GAO has reported for many years to Congress on significant problems with agency efforts to fully institutionalize GIPRAMA to the point where line managers voluntarily choose to use performance data for daily decisions, and why some agencies are simply content to settle on more symbolic responses that merely satisfy legal compliance standards, or at most value the instrumental uses of performance management, as Professor Moynihan has aptly described in his seminal work, The Dynamics of Performance Management in 2008. So having personally served for 36 years in the federal government in different agencies, I know firsthand that agency culture, strategic goals, leadership, and staff capacity could matter greatly for agency implementation of GIPRAMA. During my studies, I read J.Q. Wilson's seminal work, Bureaucracy, from 1989. And when I did, I recognized a kindred spirit who understood that analysis of performance management reform must also consider possible effects of organizational identity. Performance management scholarship I read during my program suggested to me really 2 basic problems to deal with. First, here we go. First, federal laws on performance management reforms follow generally a one-size-fits-all approach that doesn't recognize important differences between federal agencies' capability to institutionalize performance management practices. Beryl Radin at Georgetown has been one of the strongest advocates and exponents of this view, but many others have observed it as well. Second, federal leaders and managers face a wide range of conflicting incentives and work under different rules of governance and organizational conditions. Some of those work environments are simply more conducive to adopting performance measures and using performance information than others are. Given this, what is the potential for federal managers who want to improve their agency's performance by first improving the institutionalization of performance management by changing the conditions and the institutional and organizational conditions of their departments and agencies? So this is not a small issue for theory and practice. The legitimacy of American government, as Donald Kettle has so rightly noted, depends in part on the performance of federal agencies. So maintaining public faith in government and the legitimacy of democracy, at least in part, rides on performance management and performance. The first research question in my dissertation asked how the different predictors for performance management institutionalization, when considered concurrently, affect the 2 primary institutionalization indicators that have been proposed in the literature. The primary ones being either the adoption of performance measures or the use of performance information for management decisions. Those were my 2 dependent variables. The second question examined the implications of the theoretical claims by James Q. Wilson's well-known taxonomy of bureaucratic types in bureaucracy. I wanted to know how an agency's identity, according to its bureaucratic type, specifically whether it's production, procedural, craft, or coping style, mediates its adoption of performance measures and the use of performance information in management decisions. Federal laws on performance management and their implementation make no exceptions for agencies based on their bureaucratic type. So I hypothesized that bureaucratic type might be an unrecognized influence on the variance of agency institutionalization of GIPRAMA 2010. A primary goal of my research was to integrate virtually all of the major categories of these predictors that come from the theoretical and empirical literature into a single inferential multivariate and multi-condition model, sort of a system of systems approach, if you will. I wanted to get beyond simple correlational studies with only one or two predictors and single case observational studies, since without controlling for other predictors, most every proposed predictor can emerge from a model as being marginally significant, and most have. I therefore developed a comprehensive yet parsimonious three-level inferential model that's based on the multiple governance framework of two British scholars, Hill and Hube, 2006, and the institutional analysis and development framework of Nobel laureate Elinor Ostrom from 2011. The model shows the external factors in the system action situation and the organizational factors in the organization action situation. These are all from the literature. The two dependent variables related to the performance management institutionalization in my model are situated in the individual action situation in the third level on the right, where senior leaders make key decisions regarding if, when, and where to institutionalize performance management practices in federal agencies. The final organizational factor in the model, organizational identity, is rarely discussed, sadly, in the performance management literature beyond simple definitions and concepts. It has a robust presence in the neo-institutionalist organizational theory literature, and it helps to explain a lot of the variance in organizational responses to policy reform impulses. So I decided to incorporate it into my inferential model so I could test its influence on a more systemic way on GIPRAMA institutionalization. How did I do this? Well, I developed a transparent and replicable process to create a new categorical variable for bureaucratic identity by classifying it federal agencies based on the taxonomy of bureaucratic types that Wilson proposed in 1989. I did this by leveraging federal manager responses to two questions in the 2017 GAO survey of federal managers that the GAO was gracious enough to share with me for my research. Indices of federal manager perceptions of agency output versus outcome orientation were created and plotted against each other to show the relative performance orientation of 24 CFO Act agencies. I used this plot as a source to code the federal agencies based on their Wilson bureaucratic type. So this slide's a bit busy. I won't talk to all of it, but I'll summarize it. The slide gives an overview of my data collection and analysis strategies. Time doesn't allow me to provide more detail today, but in short, I combine quantitative and qualitative research into a mixed methods approach in which I, following the recommendations of Tome and Maggette in 2020, used quantitative methods to down select the statistically significant and substantive antecedents of performance management institutionalization to use in the qualitative analysis that I conducted using a 2021 survey, as well as structured interviews with public sector performance systems managers in 6 different departments. I triangulated the qualitative findings with the quantitative ones to arrive at my final findings. So what were those? Well, there were a lot of them, but I'll summarize a couple that I thought might be a little provocative. First, I found that an organizational culture of accountability and empowerment and the capacity to evaluate performance were the 2 single most consistent predictors of all forms of GIPRAMA institutionalization practices. The qualitative findings, in addition, showed the need for cultural transformation towards a results-oriented mindset may be overstated in the literature. Instead, investing in additional evaluation capacity and maturing the performance measurement system can allow an agency that doesn't have a real strong performance culture to accelerate the institutionalization of performance management. Second, the literature talks a lot about the importance of credible commitment of agency senior leaders. I studied that, and my finding was that it does prime the pump for institutionalization. Its effects on the adoption of performance measures are most felt during the early stages of institutionalization of GIPRAMA practices. And then as agencies mature in performance management practices, leadership's effects are mostly limited to improving the use of performance information for a range of management functions. So what that means is the commitment of energy of agency leaders is a critical success factor during the habitualization or early first phases of the institutionalization process. Third, external oversight is often thought of as being an important factor, but my study, it actually revealed that it actually, except for its impact on contract management and program consolidation practices, external oversight is really not statistically significantly associated with the institutionalization of GIPRAMA in federal agencies. And finally, all I can say is Wilson was spot on. The type of bureaucracy an agency does in fact affect how it institutionalizes GIPROM practices. Production agencies are more likely than all other types of bureaucracies to adopt all kinds of measures, and except for the craft agencies, to make greater use of performance information. Coping agencies, on the other end of the spectrum, are the least likely to adopt all types of measures or to use performance information. There was also an unexpected finding that craft style bureaucracies are the most likely type to make regular use of performance information. Qualitative findings from NASA, for example, suggest common management of technical programs may explain relatively high use of performance information by craft agencies. While the study results validate Wilson's claims concerning production and coping agencies, truth in lending is that the reliability of my results for craft and procedural agencies was a bit of a concern, likely due to my sample size, and that points to the need for some additional research, particularly in that area. And with that, that completes my presentation. Are there any questions?
All right. Thank you very much, Ed. Let's move on. We'll hold our questions to the end of all the presentations. Let's move on to Kevin Bronner's presentation, the use of strategic planning by county governments in New York State.
Okay, thank you very much, Mark. I have a series of slides. I should be able to go through them very quickly and do it on time. So my study has to do with the use of strategic planning by county governments in New York State. And this study started up in late 2019 with a pilot study, which fortunately ended in January 2020, just before the pandemic hit. So the basic question here is, to what extent do larger county governments in New York State use strategic planning? I'm going to modify that a little, or performance measures. And I've got some pretty good news, I think, that's developing in New York State. I'm only doing this for the larger counties because I think they're more complex, and I wanted to study them first. There's additional counties, some of them are very small. But what the study's finding is that about 65% of these larger counties use strategic planning or performance measure to some degree. Now, I don't think it's comprehensive in the counties, but at least there's some evidence that there's certain parts of the counties that do use strategic planning or performance measures. And just another sidelight of this, there's an implication for internal control from this, because I don't know how well known this is, but in the internal control field, which I do a lot of work in, there's organizations that say to have proper internal control, you should have strategic planning and or a performance measurement system. So what that means is that governments that don't have that have an internal control lapse. And I'll discuss that later in the study. So the way this started, I just made a real simple slide. Now what we're looking for is some of the basic strategic plan concept. I use the John Bryson model, as was mentioned earlier today, but I use the same basic model. But some of the things we're looking for is a stakeholder analysis, vision and mission statement, and then goals with measurable objectives. So the way this study started off, like I said, there was a pilot study, and that was conducted that was completed just before the pandemic started in January 2020. And then what I did after that was, I'm also looking at city governments and town governments, but this part of the study is just on counties. So what I did as this study matured, last year I started to develop it a little bit more. So I chose a group of 17 of the larger, these are the big money counties in New York State. And this started off with, we have a freedom of information law, and I sent in requests to the county governments. And I received a ton of email or telephone responses. Some of the counties sent in strategic planning documents. The basic question was, do you have a strategic plan and can you make it available? So some of the counties did send it in. Now, what happened earlier this year, there's a New York State Association of Counties, and they started to give me some input on this. So I may be working with them in order to promote strategic planning. The first part of this will be to have a little story in the newsletter about the county, their newsletters stating how the counties use strategic planning, and maybe it'll mature from there. So that's good news that the New York State Association of Counties wants to help a little bit with this. Right now isn't the time to do this for them because our state budget just passed on a little after April 1st, and there's all sorts of bills flying around, and they're all immensely busy studying them. But the good news is the New York State Association of County staff looks like they're going to provide some input to this study. And then another piece of this, I look at websites also, because sometimes with the FOIL request, you wonder, did they really answer it properly? Did they want to answer it? So I can gain a little bit more information by just doing a website research for the counties. Now I've got 3 slides. I'm just going to go through them very briefly. This is the size. These are the counties in the study and the size of their budgets. Okay, so and I'll just blast through those. You can look at them if you want. So what I have to date, and I just threw out some examples of what I thought were really nice strategic plans that I found. So Albany County, that's the county. I live in Albany, New York, and that's the local county where the state capital is. They have a nice health department strategic plan, which they sent me in at the end of 2019. It was pretty interesting to follow the strategic plan during the pandemic because they had a lot of information going on, a lot of activities. Some of the other ones, Monroe County, that's out by Rochester, New York. They have a housing strategic plan. Niagara County's out by Buffalo, New York. They have a nice economic development plan. Onondaga County is in Syracuse, New York. They have a planning department. Strategic plan. Then Oneida County, that's a small county out by Syracuse. They have a county plan. Ontario County has an economic development and a solid waste plan. And Putnam County, which is north of Westchester County in southern New York, has a health department plan. That isn't an exhaustive list. I just want to throw out some examples of some of the plans that are out there. Now, if we look at, there were some other counties in this study, and these are some of the really big ones: Erie County, Nassau County, Suffolk County, and then Rockland County. That's not as big as the other 3. I found some nice limited strategic planning and performance measure systems in those counties. So I'm putting them in the group of counties that has some sort of a performance measure study. And then what I did, I just have a table at the end of this where I list all the counties. So what I show, I list them like Albany County in the FOIL request. That FOIL is for FOIL. If I found some evidence of strategic planning there, I would give them a yes. And then the Association of Counties came up with a few examples. So I gave them a yes there. And then I also did the web search. So if you look at a county like Erie County, a big county out by Buffalo, the Freedom of Information Law request says that no, there isn't a strategic plan. The Association of Counties didn't have any input to me on that. But then the web search showed it did, and I put limited next to it because it really wasn't a full strategic plan, but it was a nice performance measurement system. And I went through all the counties in these tables, and you can just follow it. And you come up with about 2/3 of the counties. The good news here has some kind of a performance measurement system or a strategic plan. And I'll be following up on this, looking at the quality of the plans and I maybe go through the FOIL process again, because I was doing it last year. I started it up like April and May of last year. It looked like the pandemic was fading away, but it didn't fade. There were some variants that came back. So there's a possibility some of the counties were having difficulty during that period. So I'll be reviewing a lot of this. Now, just a couple other points on this. In New York State agencies have to have strategic planning, which is interesting. Well, basically, the local governments don't unless there's some requirement in a grant. But the New York State agencies have to have a strategic plan. And this comes from the Office of the New York State Controller. And they have a document about standards for internal control in New York State. And basically that says if you don't have a strategic plan and performance measures, you don't have internal control. So I'm trying to promote this idea that's for the state agencies to the larger local governments. I don't pursue the smaller ones at this point. There's always a cost benefit analysis issue. Can you have a strategic plan for a very small county? Maybe you can't, it's too costly. So I'm still dealing mostly with larger governments as I do this. And then just a final point here on internal control. There's this committee on sponsoring organizations from the 1990s. And that really says that the achievement of objectives is a major element in developing internal control. Now, this is a very recognized organization. I'm sure a lot of people have heard of it. So the only point I'm making at the end of this is when we're looking at strategic planning or performance measures, there's a really big linkage to internal control. And I think that should be given some emphasis, in our field. And then I just have, if you have more information, if you like some more information, you can send it in there. And I do have strategic plans. Some of the counties sent them to me. I'd be willing to forward if someone wants to see like that Albany County strategic plan. It's a pretty tight document. It's about 15, 20 pages long and has some good information in it. With that, thanks, Mark, for letting me speak.
All right. Thank you very much, Kevin. Very nice. Okay, and to conclude the panel, we'll hear from Kevin Marino, Robert Wright, Ken Powers, GEPRA, and administrative tethering.
Thank you, Mark. It's an honor to be here with NCPP again. We so much thankful for all of the, and Arun, may I share my screen?
Yes, I think, Woody, you'll have to stop the screen share. Oh, sorry.
Okay, while we're waiting on to shift the screen, because we're on a time schedule here. What I wanted to present is something at the local level that we've been working on for various years about administrative tethering, which is a new theory and practice in regards to collaborative governance, specifically around child protection services. I've been a child protective professional for many, many years, and it is definitely, it has strategic performance measures from the federal government. Our Child Family Services Review measures are brought to the state by the Child Abuse Prevention and Treatment Act of 1996. Every state has to adopt those measures into their performance evaluations. And so in the state of North Carolina, we're set up a little bit differently because even though we're federally mandated, we are state administered or state supervised and county administered here in the state of North Carolina. And that presents with very interesting challenges because there are 100 counties in the state of North Carolina. And so when we're looking at improving child protection services, and when we look at preventing child fatalities, there has to be some type of stronger collaborative at our stage, at the practitioner stage, because as a practitioner, it's very, very different from what is happening at the state level or the federal level, because we're the boots on the ground. We see every day. We're with the children, we're with the families, looking at them in the face. And so we get a lot of performance data pushed down from the feds, pushed down from the state to the local level. And all of this information creates a poverty of attention because it just distracts us, as Herbert Simon would say in 1947, which is the seminal work we base our theory on, his notions of bounded rationality and near decomposability. And so when we're looking at this heavyweight, the complex issue of child protection, needing all of these points that were made today, agency capacity, turnover, how do we train and teach professionals in the field to be not only competent, but emotionally, physically, spiritually fit to do this work. So Gepper really sets out some great points for us to be guided upon in regards to looking at the human capital, the resources, what's going on in the interagency work, and then agency to agency work, and then the strategic plan, and then continual evaluation, right? And so at this forefront, Kettle said in 1996 that really the anchor in on what you're doing is to define the mission and frame the goals around those objectives, and then assign responsibilities and look at those specific measures and compare goals and outcomes. And so every county or every state governance has to be accountable to meeting these measures, preventing child fatalities, reducing child maltreatment, preventing kids from going in foster care, preventing them from in foster care for long periods of time. And so looking at how we can move the needle forward at the local level, because our state systems oftentimes get stuck in bureaucratic inertia, and that does not alleviate us who are doing the job from performing well in the field with families, right? And so we have to take a greater ownership in doing that. And so this collaborative theory process of tethering agencies, tethering people together on a very focused mission. And in child protection, it's pretty simple. Keep kids safe, keep kids alive, right? That's your focus. It doesn't have to be some elongated paragraph or discussion about what the mission is. It can be very simple. Keep kids safe and keep them alive. And so administrative tethering touches on the emotional equity in regards to trust, value, accountability, and motivation. And in the specific agency, in the actors in those agencies, and then from agency to agency, as we measure that the fitness of being able to collaborate together. And so those 12 measures, out of those 4 elements, we devised a process of engaging cultural studies of each agency to determine their fitness to tether together and to collaborate to move the needle forward. And the specific incidents in North Carolina that we're talking about, that our book is based on, is in regards to building better training systems for child welfare professionals. And so Robert and I devised the measures and the outputs for that. And so when we studied this in North Carolina, we looked at 10 different agencies in the western part of North Carolina, rural, metro, all these different counties of various sizes, all have child protection agencies inside each county. And so when we looked at that and began to study the pre-AT intervention, this is what we found. There are issues with trust, there's issues with communication, there's all types of issues based on those 12 components, and go back and look at the slides afterwards so you can familiarize yourself with those 12. After the AT intervention, which is relationship, it's more focused on the relationship. So me building a relationship with you is more important than what you can do for me today, because combining that relationship and tethering towards this mission helps us to mitigate areas where our rationality is bound. I love what Alan said, is that there are hard silos. And so to break these hard silos down, relationship is a highly effective element that we've seen here through the AT applications. So looking at bounded rationality helps us to determine the areas of near decomposability, so that we can look at where change is most pliable and plausible. So if you have 2 units that aren't quite meshing, or you have an incompetent manager, then these measures per agency can detect where those areas are and provide a mitigating strategy to deal with that, so that all 10 of these agencies in Western North Carolina, after applying the AT mitigation, we were able to get them into a fit arena of collaboration. And so what we were able to accomplish inside of that was we built a new training system. We built a more competent training staff, and our performance measures in our region are some of the best in the state at the moment. Okay. And so inside doing that, we've also been able to reduce the turnover rate. Every single person that we train through Real Academy, through this methodology, 99% of those trainees have stayed in the field for more than 3.5 years, which in child welfare, if you know your statistics, it's 38 to 50% turnover nationwide, and the turnover periods in time are at 2.5 to 3.5 years. And so longevity-wise, we're building a stronger workforce that can meet the criteria from the performance measures and stay in the industry knowledge of child protection services. And so what are we doing today? Number one, we're expanding the AT over to the OUD and SUD issues about an opioid epidemic, right? And so in Henderson County, Bob and I have undergone an evaluation from COSAP, and we have another one with SAMHSA, to where we're looking at a very local issue with this one county. And you can see all the stakeholders that are involved in the pre-AT condition that we have to align, and we have to measure their fitness and readiness for collaboration. And so what we've been able to find in the pre-AT conditions is that the hypothesis is that a behavioral health primary indicator or primary analysis would be driving more people towards SUD or OUD issues, substance use disorder or opioid use disorder. And what we were able to find is the opposite application from the first set of data. And also we were able to find through the bounded rationality of these hardened silos, that children ages 13 to 17 were overdosing, and there were some fatalities. And so being able to detect the overdoses by working on those relationships, because all these data sets live in these different stakeholders' worlds, and we don't share those things. And there's no large data set that helps us to indicate all these different factors. And so again, it's the local's responsibility to care for their citizens locally. So these pre-AT conditions that we were able to find moves us into the ability to work with the AT factors and measure that each of those entities come together and form a mission, because this county still doesn't have a singular mission in how they're going to address the opioid issues. I'm going to turn it over to Bob and Ken and let them talk about the next area of research that we're working on, which is the Navy Marine leadership. So just briefly.
Can you hear me okay, folks? Is it?
Yeah, we can hear you, sir.
Okay, great. Well, just to build on what Kevin was discussing, to look a little bit further into Simon, what we're looking at in essence here, and it's kind of based upon the last presentation with the Marines, et cetera. It's twofold. One, to kind of compare AT with another sphere, if you will, in the effort to build theory and do that kind of work. And then secondly, to really ground it in another venue in terms of the NDBR perspectives, in that, as per Simon, his notion was, how do people really behave? How do they really act? And so that drove in, with the initial work that we presented roughly, 2 years ago, and thus the book. But ultimately to look at how the ability to understand one's role in an organization, and understanding too that culture within an org system is a very powerful force that makes folks with diverse backgrounds, et cetera, do and engage complex things. And this is where, and I note the word complex, because part of our work was, when we were doing it in North Carolina originally, was looking at complex problems and collaboration. So that brought us to the notion that, there's really, when you look at collaboration, what you're fundamentally looking at is coordination. And coordination is costly. It's a costly undertaking. And it's not only in the actual event, but also the ongoing nature of it. is a budgetary issue, and that kind of harkens back to the Performance Act, et cetera, some of the aspects of it. But ultimately, when we looked at AT, the notion of kind of the burgeoning notion and where it was heading was, we felt that there was another component to it, and that's where Simon's notion of near decomposability really struck a chord in that it looked at adaptation and evolution, how organizations change, and how that if they don't change within a particularly complex, dealing with the complex issue, they tend not to survive. Or if they survive, there's a lot of harm that's done, and more importantly, the social product's not delivered. So that's where we came up with this, or not came up with it, but kind of aligned with what Kevin originally showed on the screen. Some of the indicators, if the observables in a SEM model that we kind of work with to then see ultimately could we, in a higher order factor, confirmatory factor analysis, we did the original PCA, et cetera. So we arrived at the FO, which you can kind of see right above here, which is our kind of coding for fit organization or not. So that's kind of like the precursor, if you will. So what we did is we took the, at this point, we're still working on the data and so forth. We actually looked at a recent report from the GAO articulating how supervisory, there's a need for supervisors, et cetera, and Ken will go into it further, to be part of the equation in a more formal and kind of more potentiated manner than it exists now, because that has led to significant problems in terms of building ships, et cetera. That said, what we did is we took the 2020 release of the OPM data sets and all its works and whatnot, and kind of drilled down, and we actually looked at the Navy. And we all know that the Marines are part of the Navy, which for better, you know, I don't know if they lead it or what, but that's, I think Ken can speak to that a little further. But in essence, we kind of compartmentalize these, if you can kind of see, we coded it by BR and D in terms of the input of the leadership as well as the supervisory. And initial findings are indicating that they need to be involved kind of a little bit more, a little earlier in the process, and or they seem to be very fundamental or very valuable or needed, if you will, in the initial phases of somebody's work, motivation, leads to trust, et cetera, which I think Kevin was noting. So it's kind of the frontline component of it. So we I think it's like 34,000 records, so we're working with that at the moment, and we're kind of juxtaposing it against this GAO report that just came out, I think last week roughly. So, and with that said, I think I'll turn it over to Ken, who's proffered some very good, interesting ideas through his years of experience with this. Ken?
Okay, thanks, sir. So yeah, so when we take the GAO report, okay, what we have to keep in mind is, yes, Department of Navy is responsible for shipbuilding. So when we talk, okay, strategic plans, you know, from a institution such as the Navy, well, the part that goes into that and what we're calling, and why we were able to come up with institution to institution, would be such as Department of Navy, you know, dealing with Department of Air Force. Okay, but when it comes to strategy and the fact that the Marine Corps as part of the Department of Navy, and specifically to shipbuilding, for instance, the Navy is going to build ships based off the requirements, but those requirements, and they require not just an institution to institution type collaboration, but at the unit or unit to unit, such as the Marine Corps and what missions or what strategic objectives they need to achieve in coordination with their fellow brothers in, you know, as part of the Department of Navy, the Navy side, in order to meet that requirement. So it's not just Department of Navy building ships, but rather you do have a lower level kind of or what we would probably call the tactical or the operational lower level planning, requirements that go into that overall, efficiency in building the right types of ships. So I've been associated with DoD for many years. Was former Marine, and I see you see a lot where because you don't get the lower level unit to unit type collaboration, that when you want to talk strategic, by the time it gets to that level, a lot of time is lost. A lot of valuable information, direction that needed to be go, which ultimately results, in my mind, as less efficiency and more taxpayer money. So I'm really excited about this, because we did expand it again as to include the Navy aspect, because the Marine Corps, as we used last year, they don't operate alone. It's in conjunction to two that it requires that lower unit to unit, or what we're calling unit to unit collaboration internally to the Department of Navy as an institution. So I think that's thank you.
All
You got
right.
it, Ken. Thank you.
Thank you very much, gentlemen. All right, so we've heard, excuse me, 4 very excellent presentations. What I'd like to do before we open it up to full questions is pose a question to each panelist to get the Q&A started. So first, I'd like to ask Woody, to what extent do you see carryover in strategic plans from administration to administration? I know you mentioned that they're indeed based on the policy preferences of each administration, but you did mention something about climate control, and where it was a bigger issue in previous administrations than the Trump administration. But are there areas that you do see carryover in the strategic plans?
Well, thank you for the question. I did show one chart that looked at the goals, the strategic goals, and what percentage were new versus what carried over. And then also the agency priority goals. Also looked at that and found that there was quite a bit of turnover there. Anecdotally, I could say, looking back at the Trump administration, they specifically, their agenda in the area of immigration, for example, they specifically added objectives like in the Justice Department for immigration enforcement at borders. That's just one example. Back in the Obama administration, there was an emphasis on hiring reform, which appeared as an APG. So each of these administrations have their priorities, and they're reflected in the plans. And you can see changes in goals and objectives based on those priorities. But the underlying message I wanted to make in this presentation is that there's a lot of consistency in terms of what's in the plans and how they're put together across administrations, regardless of what the policy changes are. I'll stop there. I don't know if Matt wants to say anything.
I'll mention the Biden administration put out a memo directing agencies to align their strategic plans to 3 priorities: addressing climate change, advancing equity, and then responding and recovering to COVID-19 pandemic. So some agencies included new strategic goals at that level. Others weaved those priorities in at the objective and strategy levels.
Mm-hmm. Okay.
Yeah, one of the challenges in analyzing these plans is that there is no requirement that they put the document together with any kind of machine language or any format that's easy to extract the information. So one of the limitations of the research is you have to go in and read hundreds of pages of plans and then code those plans without any technology. I mean, that's why we're limited in what we can show here, but it's just a resource constraint also in terms of having people who can go in and spend the time coding the plans. But it would be nice if we had a format that was machine ready to be able to pull all this data out And that's one thing I would recommend to OMB if they ever get to that point. It would be helpful.
Yeah, okay, thank you. Turning to Ed, in your presentation on institutionalizing performance. So indeed, there are various factors that lead to the institutionalization. But my question would be, how can that institutionalization of organizations be improved ultimately to facilitate GEPRA and performance management within those organizations? Is there a way to actually, what would be your suggestion?
Sure. So that's taking my findings to the next step, which is the recommendations, which I didn't actually have time to cover in my presentation. It's in the dissertation. But the bottom line is, if the findings are correct, then there's a number of ways that the institutionalization of GIPRA, or for that matter, really any performance management reform could be conducted, both at the governance level, meaning outside of the agencies. All of the the law itself has enough ambiguity to create some confusion in implementation and wiggle room for managers who want to oppose it. But my findings showed that really, oversight such as Congress or OMB or GAO, of all three of those, only OMB oversight really mattered very much. Most of the work is going to have to be done within the strategic level of each federal agency and department. Senior leaders have to take a more active and involved and committed role at every step of the institutionalization process. To help them, both the OMB and the Congress can create stronger incentives for them to do exactly that, and not to merely undertake minimal efforts and symbolic actions. I think it was mentioned in an earlier presentation that more continuity amongst the political appointees would help. I wholeheartedly agree with that. In the qualitative portions of my research, I found exactly that quite a few federal departments suffered from lack of continuity by the senior executives and political appointees in their department, the politically appointed senior executives, not the career ones. So you have things that can be done to tweak the system, to tweak the governance, to manage the executive leadership portion of it, and then within the actual organizations, there seems to be almost a Chinese firewall in a way between the headquarters and many of the business units, the operational units, where you have performance management, as recommended or as required by GIPRA, that is effectively going on at the headquarters, but it hasn't really trickled down to the operational line units. And in some cases it has, and in others it hasn't. And for me, that was a telling indicator of a department or an agency that has gone beyond the letter of the law to actually voluntarily seek to leverage performance management for the performance benefits you can obtain from it by letting it advance or requiring it to advance further down in the organizational chain to line managers and even frontline employees. So organizations can take as a best practice how that works in the organizations where it's very successful. Some organizations actually, I found, like, for example, NASA, they already were pretty much doing performance management from even before GIPRA days, because so much of their scientific and technology programs require a very high degree of monitoring of performance and different metrics and indicators. Others, like in the Department of Homeland Security, there was a significant issue with that not being a history, not being a tradition. So you have some path dependency going on between the federal departments and agencies, which kind of makes it more difficult for senior leaders who wants to institutionalize performance management to do so. So that's why, if you look at each of the different conditions that affect the outcomes, they do vary to some degree between the different departments and agencies. So there isn't a one size fits all approach to institutionalization. Each department and agency needs its own institutionalization strategy. And then the final recommendation is, if we're going to legislate performance management across all 24 CFO Act agencies, at the time that we're developing the legislation, we have to bring in those voices of the people who would be responsible for implementing it, for institutionalizing it. They need to voice concerns, and they have to highlight local organizational conditions that might be an impediment to the institutionalization. I do not believe, 90 pages of my dissertation was on the history of the performance management movement in the United States federal government. And it's pretty clear from the history that if there's one failure of our legislators in the last 30 years, it's a failure to look to the institutionalization requirements for the law and roll that into consideration when the law is being written. So, at the governance level, that is probably the number one recommendation. So I hope that answered your question.
Yes, very much. Thank you. Kevin, like your research on the New York State counties, or the counties in New York State. How much variation of the strategic plans did you notice that existed amongst the sample that you have? I guess those 17 large-sized counties.
Yeah, thanks for the question, Mark. That's a good one. There is quite a bit of variation. Like some of them really look like strategic plans, the John Bryson model, with you do an internal and an external review of the environment. You have mission statements, vision statements, then you have performance measures, and then other ones are just like studies of a highway department with just performance measures without any real indication that it's a full-fledged financial plan. So what I decided to do when I pulled this all together, when I first did this, I had a requirement that it really be a strategic plan. It should say on the front of it, like Albany County Health Department Strategic Plan. It said that, and some of the other counties had that. And then when I started to see some pretty good systems with performance measures, I said, I'm going to expand this a little bit, and I'm going to include those studies in the analysis. So some of them are full-fledged strategic plans. They look and sound like a strategic plan. Others are more departments that have a nice system of performance measures. And when I decided to pull this all together, and some of this came from the New York State Association of Counties thoughts too, I decided, well, if you have a performance measurement system that seems to be working and is giving us good data, then I think that you should get credit for that. So that's why I expanded the study. But your question about do they vary a lot? Yes, they do.
Mm-hmm. Mm-hmm. Yeah, okay. And I imagine there's a bunch of factors that lead into that variation. All right, thank you, Kevin. And finally, Kevin, so your model looked at child welfare organizations or the child welfare organization in North Carolina, and I guess armed forces leadership, the Navy and the Marine. So those are obviously two very different organizations. How well has your model been applied to each?
So the model that's being applied in the different settings at this point, Mark, it's adapting very well because it's engineered to deal with the human relationships, the people. It was said earlier that we have to get down to the local level of the people that are providing the service, because we are the ones that are generating the data. We are the ones that are generating the outcome. And so the administrative tethering point is that the organization's health and its ability to perform said public service is critical. And so if we move that application, not from just child welfare, because it is a highly complex system, over to a different system, such as the new study that we're working on in Henderson County, where you could see the various stakeholders there. You have public health, DSS, schools, law enforcement, courts, all these different folks that house different data sets and have different perspectives. They have their own organizational culture. And so in order for us to come together and move the needle and make progress with the opioid epidemic, then all of these folks need to work together. And so that it's the investment in that human capital in those specific relationships and understanding that relationship is a life cycle. It's not something that it's just a good idea for us to collaborate, but it moves forward. We find interest in each other. We're attracted to each other in those senses towards the mission of reducing the fatalities, the harm, the emotional disparities, and the trauma that SUD and OUD produces. And furthermore, it can be applications in the military sense as we look at the processes of what goes into the Navy's efforts to procure experts that build these ships, strategically place these ships. There's a lot of work that has to go into making sure that that output fits. And so the only way to truly accomplish that is building the relationship instead of publishing a procurement for a request for qualifications or you meeting certain criteria. There needs to be a coming together with you and I to understand, do you truly understand at the boots on the ground at the local level what the people that are going to be manning these ships are going to be able to do with said ship? And is it going to be strategically effective based on the goals that the Navy sets forth in various arenas? And so we're finding that AT truly helps to strengthen relationships that help us to produce greater outcomes. So we look forward to working heavier into the post-AT and reporting back to you at some point and letting you know how well it fits in this new research.
All right, great. Thank you, everyone, for your contributions and your very educational, exhilarating, and exciting presentations. I know we're up against the time where our guest speaker, Dr. Kamensky, is set to deliver his discussion, his talk. So I'll turn it back over to Dr. Manoharan to lead us into the next session. Thank you, everyone.
Thank you, Dr. Fudge. Thank you, panelists. That was a really fascinating session. A lot of important issues discussed that pertain to the implementation of performance measurement systems. And so it really builds upon the previous two panels. So thank you again.